Welcome. My name is Allison Winnike, and I am the president and CEO of the Immunization Partnership, a nonprofit dedicated to eradicating vaccine preventable diseases. It is also my great honor to serve as chair of the Pandemic Vaccine Task Force. Today, I and some of my fellow task force members will discuss our recommendations to enhance COVID-19 vaccine distribution and access in Texas. We convened the Pandemic Vaccine Task Force, which is made up of 18 vaccine experts from across the state, to develop recommendations on how Texas can enhance its draft COVID-19 vaccine distribution plan in the areas of vaccine allocation, distribution, and administration. Our mission with these recommendations is to minimize the impact of COVID-19 on hospitalizations and deaths throughout the strategic and tactical rollout of our limited COVID-19 vaccine resources to our high-risk groups. And once we get a high immunization rates of our most at-risk phase 1A and phase 1B Texans, our mission, while we still have limited vaccine supply, moves towards mitigating the prevalence of COVID-19 in our communities by prioritizing those with the most exposure to others. And then finally, once we achieve adequate vaccine supply, we want to focus on vaccine hesitancy and targeted population outreach. Our 12 recommendations focus on the following 4 priority areas. First, support to COVID-19 vaccine providers. Second, health equity. Third, COVID-19 impact on high-risk Texans. And fourth, transparency in vaccine allocation and distribution. These 12 recommendations were shared with the state and are also available online at www.immunizeusa.org/COVID, COVID. Now I would like to introduce my colleagues from the Pandemic Vaccine Task Force to discuss some of the recommendations. We will also have comments in Spanish at the end of the press conference. First up, we have Dr. Melanie Mazzoon, who serves as managing physician for immunization practices and pediatric hospitalist at Kelsey-Seybold Clinics. Dr. Mazzoon, would you like to speak to some of the recommendations that would help support vaccine providers, such as improving our immunization registry and expanding provider sites?
Yes, I think that this is actually an ideal time to be thinking about improving our state immunization registry, which has been opt-in and primarily focused on children for years. As you may know, the immunization registry is including information on the COVID vaccine for all adults in the state of Texas who receive that vaccine, and also those who receive COVID treatment with certain biological agents. And this is an ideal time to consider keeping those records for longer than the mandated 5 years and really enrolling lots of adults into this registry by making it opt out. That is, assuming that Texans would be pleased to have their immunization records held by the state as a backup to their own records, so that doctors can let the state know which vaccines have been given and allow the state, then the health department, to know what areas might have vulnerabilities, for example, to measles and other infectious diseases besides COVID. So making the registry opt out would be a very helpful and less expensive way of obtaining immunization records for individuals who at various times in their life have to come up with an immunization record for employment and other reasons. Your second area, I think, was about, your second question was about the support to providers and the current allocation scheme. So I think that the state has done a good job by having hubs where, particularly in communities where there are not a lot of people who have insurance or who have primary care doctors. But I think it's time now for the state to be sure that it's allocating vaccine supply to providers who know which of their patients are vulnerable. So a lot of providers are still getting very short supply while the hubs are, getting strong supplies. And I think it's important to recognize that individual providers know which patients need the vaccine. They have patients calling their office who would prefer to get that vaccine in their office rather than going to a large hub and have the exposure to crowds. And we're able, through our computer records, to schedule those patients and get them in efficiently. Our clinic at Kelsey-Seybold, for example, generally can immunize about 9,000 patients a week during flu season. And that's more vaccines than have been allocated to the hubs. And so we think it's time for not only large providers like my clinic, but other providers to have more access to this vaccine.
Thank you so much, Dr. Mazoon. We really appreciate your comments on the recommendations. Next, I would like to introduce Dr. Mary Catherine McNatt. Dr. McNatt serves as Associate Professor and Chair of the Department of Public Health in the College of Graduate Health Sciences at A.T. Still University. Dr. McNatt, would you like to speak to some of our health equity recommendations from the task force?
Hi, Allison, thank you. So I'm going to briefly summarize some of the health equity concerns and some ways to mitigate them. First, we know that COVID vaccine information resources, they need to be culturally appropriate and provided in multiple languages. We know that we must vaccinate the majority of Texans in order to achieve herd immunity levels. Currently, the United States Census tells us that there's about 165 languages spoken in Texas. So languages don't need to be a COVID-19 vaccine access or administration barrier. Registration points and vaccine locations need to utilize images to reduce barriers for non-English speakers, as well as Texans with low reading capability. Walt Disney once said that reading and that pictures are the universal language, and that is so true. What we've seen before in evacuation shelters is that pictures are actually, they're very non-intimidating, and they can be very efficient and effective. And so that was our first recommendation. Second was to implement the COVID-19 Community Vulnerability Index, also known as CCVI, data into the state distribution and allotment software. This valuable data can help the state target the most vulnerable communities, as well as identify the need of additional support and resources during COVID-19 pandemic. After identifying locations, Texas can also utilize these to target communities and events, which going into targeted communities can also help us set priorities. The third one was to coordinate funding for programs that reduce health disparities in immunizations. We could aggressively pursue funding from federal government, businesses, sectors, as well as utilize community health workers and promotoras. This can be very effective along the borders in our rural populations, which we know are very under-targeted and are not utilizing and also under-vaccinated in Texas right now as far as COVID-19 goes.
Thank you so much, Dr. McNatt. And finally, I would like to introduce Dr. Maria Elena Batazzi, who serves as Associate Dean for the National School of Tropical Medicine at Baylor College of Medicine, and also serves as co-director of Texas Children's Hospital Center for Vaccine Development. Dr. Batazzi, would you like to speak on the recommendations on increasing transparency and improving messaging?
Absolutely. So I would like to briefly summarize our top 3 recommendations for the need of increased transparency in vaccine allocation and distribution, and the importance of clear, concise messaging to diverse audiences. So to start, to increase transparency, we need to enhance clarity on the following. 1, how the decision-making process at the state level is done, determining COVID-19 vaccine allocation to providers as well as to individuals. For instance, the COVID-19 Expert Vaccine Allocation Panel, EVAP, must hold public meetings and accept public testimony to ensure it follows regulatory and other agencies, and primarily driven their decisions and their discussions on scientific evidence-based information. Second, how does COVID-19 vaccine providers provide options to access and register for vaccine appointments? And third, how do individuals find COVID-19 vaccine information and resources, and how they must be culturally appropriate and provided in multiple languages? Now, moving to the top 3 messages related to how we can improve communications and, of course, information. The first one is that we believe messaging should be targeted to increase public trust and transparency. Preparing and designing communication campaigns that have to be tailored and targeted specific to local communities with appropriate methods and where language should not be a barrier. Second, messaging should clearly state the desired end in mind and what will take to return to normality. Currently is to decrease the impact of disease immediately for those most at risk for hospitalizations as well as death from COVID-19. And lastly, we really need to enhance the trust by incorporating trusted community partners who can really amplify the public health messaging to build trust in the scientific process, to build trust in the vaccine development process, and to certainly highlight COVID-19 vaccine safety and efficacy data.
Thank you so much, Dr. Batazzi. And now, if you wouldn't mind delivering some remarks in Spanish on the recommendations for our Spanish-speaking audience.
Yes, voy a cambiar ahora a español y yo creo que voy a empezar con algunos, resumir brevemente nuestros hallazgos, primero sobre las principales preocupaciones para lograr la equidad en salud en poblaciones diversas y cómo mitigarlas, y después hablarles un poquito acerca de nuestros hallazgos principales en el área de incrementar transparencia y también cómo diseñar mejores campañas de comunicación. Con respecto a cómo mejorar y lograr equidad en salud, hay varios componentes que resaltamos en nuestras recomendaciones. Uno, debemos vacunar a la gran mayoría de los tejanos para poder alcanzar los niveles de inmunidad colectiva que son necesarias para poner fin a la pandemia. El Censo de Estados Unidos estima, por ejemplo, que en Texas se hablan más de 165 idiomas y por eso es que tenemos que adaptar a que los puntos de registro, los lugares de vacunación, no solo deben usar lenguajes adecuados, pero también utilizar imágenes, porque imágenes reducen esas barreras para los que a lo mejor no hablan inglés y a lo mejor aquellos también que tienen poca capacidad de lectura. Como lo dijo muy bien Walt Disney, las imágenes son el lenguaje universal. El idioma entonces no debe ser una barrera para el acceso o la administración de la vacuna. Ahora, hay también otros métodos para poder implementar mejor cómo se hace la distribución y la asignación de vacunas en el estado. Y es utilizando índices de vulnerabilidad comunitaria. Por ejemplo, la Fundación Surgo combina estos datos del índice de vulnerabilidad social del Centro de Control y Prevención de Enfermedades, que es el CDC. Y los combina con factores epidemiológicos, del sistema de atención médica, para poder identificar en realidad cuáles son las comunidades que necesitan el mayor apoyo y los recursos adicionales durante la pandemia. Estos son valiosos datos, pueden ayudar al Estado a realmente enfocarse en esas comunidades vulnerables. Texas puede usar datos del CCBI para poder identificar cuáles son las de mayor riesgo, informar la distribución, cómo se asignan las vacunas y determinar realmente cuáles son estos sitios comunitarios ideales donde se pueden implementar unidades móviles u otros sitios de administración, como son iglesias, clínicas o centros comunitarios. Después de identificar estos lugares, Texas también debe implementar campañas para informar a las comunidades de una manera objetiva, mediante oportunidades también de cómo proveer mejor registro para poder obtener citas de vacunación. Y estos métodos pueden ser alcances telefónicos, boletines comunitarios en las iglesias, señalación en los negocios locales o también, por ejemplo, en los sistemas locales de mensajes de emergencia. A medida que Texas reciba suministros adicionales de vacunas, entonces el Estado ahí puede priorizar la distribución en áreas también con mayor prevalencia del COVID-19 para reducir este impacto de la carga y la severidad de la enfermedad. O sea que las prioridades de vacunación y de distribución sean basadas en la población y la prevalencia de la enfermedad donde sea más aparente y transparente para el público. Ahora, hay que también coordinar la financiación de programas para que reduzcan estas disparidades y alcanzar esta equidad en salud. Debemos buscar activamente oportunidades de financiamiento no solo del gobierno federal, sino que también del sector empresarial para apoyar programas que reduzcan las disparidades en la educación y el acceso. Por ejemplo, trabajadores comunitarios de la salud, promotores de salud, son un recurso que sabemos son subutilizados, pero son críticos para poder alcanzar y educar a las poblaciones vulnerables y marginadas. Entonces, estas asociaciones creativas con respecto al transporte para poder acceder vacunas deben también coordinarse con grupos cívicos locales y con líderes empresariales y así poder ayudar a las comunidades rurales y de bajos recursos. Entonces, para terminar, también les puedo resumir cuáles son las 3 recomendaciones principales para poder alcanzar una mejor transparencia. Como se realiza el proceso de toma de decisiones, es muy importante que sea transparente. Por ejemplo, el panel de asignación de vacunas de expertos COVID-19, el EVAP, debería de realizar las reuniones de una manera pública y aceptar testimonios públicos y asegurarse de que se sigan recomendaciones de agencias, incluyendo aquellas agencias reguladoras, especialmente impulsando información basada en evidencia científica. Como los proveedores de vacunas también proveen opciones, hay que asegurarse que ellos también sean transparentes de cómo se puede acceder a registrarse y a obtener citas de vacunación. Pero lo más importante es que personas tengan que tener el acceso para poder encontrar la información y los recursos para entender acerca de qué son y cómo se usan y qué beneficio traen las vacunas. Y esto debe ser culturalmente apropiada y proporcionadas en varios idiomas. Entonces, el mensaje tiene que ser conciso con objetivos para aumentar confianza pública y transparencia, con campañas de comunicación no solo diseñadas y dirigidas a comunidades especiales, sino que con métodos apropiados. Este mensaje tiene que indicar claramente cuál es el fin deseado que queremos llegar en este momento. Urgentemente queremos que disminuyamos de inmediato el impacto de la enfermedad para aquellos que tienen el mayor riesgo de hospitalización y muerte. Y si incrementamos la necesidad también de incluir socios comunitarios confiables, esto es lo que va a lograr amplificar los mensajes de salud pública y así generar confianza en el proceso científico, en el proceso de cómo se desarrollaron las vacunas y, más importantemente, cuáles son los datos de seguridad y eficacia para las vacunas COVID-19.
Thank you so much, Dr. Batazzi, for your remarks. I would also like to thank Dr. Melanie Mazoon and Dr. Mary Catherine McNatt for sharing your expertise with us today during the press conference, and also for your excellent work on the pandemic vaccine task force. And as a reminder, a copy of our task force recommendations are available online at www.immunizeusa.org/COVID. Thank you very much.